Now, for the next discussion, is more of like a, how will I put it? It's more of like there's a way I want to put it. It's a clinical sign. It's something you see on patients and they are having some one or two issues. So they call this cheilosis or cheilitis. So it simply has to do with what? There's inflammation on the sides of the mouth. There's inflammation on the corners of the mouth, so to say. Alright? So it's also called, cheilosis is also called angular cheilitis or perleche. It's an inflammatory conditions of the lips. Often the corners of the mouth are the ones that are actually getting inflamed. So what are the clinical features of cheilosis? There's painful fissures or cracks at the corners of the mouth. There's redness or inflammation around the affected area. There's a burning or stinging sensation, especially when you try to now open the mouth, which now strains the corners of the mouth. So dryness and crossing of the lips. Why? Because even to even lick your mouth is a problem, you understand? So ulcerations and bleedings in severe cases. Okay, so see cheilosis. So let's quickly talk about disease conditions that cheilosis can be associated with. So sometimes it's nutritional deficiencies like vitamin B12. So vitamin B12 can lead to what? Pernicious anemia. So it's usually seen in what? Pernicious anemia. That's the deficiency of vitamin B12. Iron deficiency too. Then riboflavin, that's vitamin B2 deficiency. Then ill-fitting dentures, poor oral hygiene. So some people it's just because their oral hygiene is low. Excess salivation or drooling. Then sometimes it's associated with diabetes, immunosuppressions, chronic lip leaking. Some of my friends used to lick their lip till their lips become so red, and sometimes used to crack at the mouth. I used to remember in high school. So that's what cheilosis, cheilitis, perleche, angular inflammation of the mouth actually means.